What time is it? Okay.
So, the place we're in now is the lobby. So, this is the busiest place. The reception area is the busiest place. Since all of the requests on the specimen, they have no here. So, it's like, if the nurse requests for, like, blood to be taken from this patient, or you request for the blood to be all the specimens. And then it's not just your room, you just have like, not even like, just that. Right to the other courses. So, if there's another job is to have the different departments to distribute the different specimens. So just explain further about our job is to allow
receive the specimens, mostly most of blood, stool, urine, and also sputum, culture for your tuberculosis. First, receive the specimen. We wait for a request form to print out a slip for the respective department. After that, we transfer the specimen to the respective department and they do the testing there. After that, we log every test that we printed out here in the books.
Why can't we hear them? Basta, all you need is the... This is where he explains the theory on the veins. No?
Yes.
and to apply pressure so that we can get blood because if you don't use the certificate, then like we get the blood won't
Bouncy.
So the three ways for the process of getting blood formation is very culture or the bottom.
I think
The bottom
Hmm?
So the three main sites for phlebotomy is this is your arm, right? And then
Okay.
if you there are three basic sites for you to get blood, which is the basilic, the venous cubital, and the cephalic. So your clue is since it's basilic vein, if it starts with a B, so it's near the body, so basilic is here. So the last time, this is your last choice, your last resort. The first priority, the first thing you should look for is the venous cubital center. Since it's the best site for phlebotomy, well anchored, it's the largest and it doesn't move that easily, so that's why it's choosing that very well. And then the last one is so it's the second choice. So pharmacy, so that's the second. You can see this one. This is cephalic vein. So yeah, your first choice would be immediately with all cephalic vein and then the basilic. Because the basilic is the last choice because it has a lot of nerves. It isn't that well anchored, so if it has a lot of nerves, it will be that painful for the patient. And you might damage the nerve. And if it's not that well anchored, so you might have a hard time getting blood. Either use the syringe or the evacuated tube or the vacuum tube. Yeah. Syringe will evacuate the tube system or vacutainer system. Like this. So, syringe is just plainly the syringe. You put it in the vein and then you get blood. And then the vacutainer is different. It's usually used when patients have many tests. Like when they have many requests.
I think my hand is covering the microphone.
It's not practical
Oh,
to use syringe.
it's okay.
You have to use a lot of tubes because this can only get a certain amount of blood. So what you use is the vacutator. So this
Fingers.
and then take this off. And then you insert the needle into the patient, and then you also insert the tube. And then once you insert the tube, the blood just flows through. Because the tubes already have a predetermined vacuum. So when you insert here, yeah, the blood just flows through there. And then, yeah, you can now, like, tube after tube. After this one, you get another tube, and you put it there. So you can get a lot of blood with just one puncture. And then, so yeah, we have 4 basic types of tubes. So, yeah,
This tube is your serum separator tube. So as you can see, it has a gel. So if you put the blood here and like centrifuge the blood, so it will be a clear separation from with your serum and your plasma serum and the clotted clotted cells. So this tube is not usually used now because the CC department and the IS department don't like the results it gives. So instead of using this tube, they use this tube. This is the plain tube. So it's a red top tube and it's just for like separating the components. After centrifuging, you'll have your serum and your clotted elements.
These two tubes, wait, the main difference between these two tubes and these two tubes is that these two, they don't have any anticoagulants, which means that when you put blood here, the blood clots. And then these tubes, they have anticoagulants. So when you put the blood here, it doesn't clot. And that's your basis for the main difference between serum and plasma. You know the difference? Okay, so serum is, so when you centrifuge this, these tubes, they don't have anticoagulants, right? So the blood clots. When you centrifuge this, we only have 2 layers. We have 2 layers, which is the clotted RBCs and then the serum, which is the yellow fluid here. But when you centrifuge these tubes, since they have anticoagulants and the blood doesn't clot, so it has 3 layers. It has packed RBC. The very thin white layer is the buffy coat, which contains your white blood cells, and the topmost layer, which is also the yellow fluid, is plasma. So that's how you differentiate serum from plasma. So the anticoagulant in this tube is ethylene diamine tetraacetic acid, and then the anticoagulant in this tube is buffered sodium citrate. It's not buffered sodium citrate. So yeah, this tube is mainly, it's usually used for CBCs. You know CBC, right? Complete blood count. So yeah, this tube is for the hemotests, and this tube is also for hemotests, but for coagulation studies. And then the plain tube goes to the CC department, and then this one is usually when you send out, like for example, there are some tests that Bella's lab do not perform, so they usually send it out to Chonghua and other labs. So that's what you use. You put the blood here, you separate it, and then you send it out to the other laboratories. Yeah, they usually don't use this. Yeah, those are 4 basic tubes. And then you notice that there are smaller tubes, right? They're purple and red. So they're just the same with these big tubes, only that these tubes are used for babies. And people with delicate and like fragile babies. Because you can only get a small sample, and that's why you put it here. Because if you only have a small sample and you put it here, then the anticoagulant won't work, since you need 2 ml for the blood to anticoagulant ratio to be okay. So that the anticoagulant will work. So if it doesn't work, it means your blood will still clot, so it's useless. So that's why you use this tube when you can get a lot of blood, and this tube when you can only get a small amount of sample. So yeah, you also have slides for when you want to make clears, and also lancets. It's for finger puncture. It's all loud. Lancets. It's for finger puncture. Right? This one you want to use capillary blood because in hematology you can use 3 types of blood. There's arterial blood, there's venous blood, and there's capillary blood. And that's why you have so many options, because these 3 types of blood have different values. So this is the histopathology department. So this is where we receive like organs. We receive large tissues for biopsies. So like just in the start of our internship, like we tried receiving a whole left leg.
What?
Here. Yes, it was amputated from the patient, so it's there. You can see it there later. You can see
So,
that.
kaning mga color, saan mo sa mga color? bed na mo. Kita mo ng wak, candle, like wak sa candle. Mara na siya gamitin para may bed bitaw mo tissue. Ano na siya like, for example.
For what? Embedding tissue. Embedding. Like,
The oven is for embedding tissue.
Like kato na tissue gi-slice, like ani na lang siya kagamay. Gamay pa din ang gamay mo na siya. What was that?
That was where you place the tissue.
Oven man na, miss, no?
Yeah, it's an oven.
Finished product. Like, gikan
Like
sa...
after all the things, after all the processing, this is the finished product.
Because
Slides na lang siya.
It's that thin, it's that small. And then you receive like the things that's like legs. And
Like legs.
Iba mo sa nila instrument.
you guys know about this. So the one, the normal ones we use to cut the tissues is that one. It's called the
Sorry,
microtome. Sorry.
it's called
Microtome.
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 Microtome, no? What?
Yeah, that one. The one with the wheel. This is also a microtome, but it's called the cryostat or the freezing microtome. This is used for
Hella big.
urgent specimens. Like for example, if the doctor is in the operating room operating on the patient and
Frozen section.
he takes this is for frozen sections. He takes a slice of the tissue and then he sends it here.
Dude, this is the one.
Yeah, it's urgent, so we don't have time for processing. Like because that takes hours for normal processing, so we don't have time. So that's why we just freeze the specimen using
Why
this
siya
liquid
freezing
nitrogen.
spray?
And what's so, this instrument has to be like kept at a certain temperature. It has to be between -17 to -22 degrees
That's why this
Celsius.
place is so cold.
Yeah.
Negative 18 to negative 30.
17 to 22 ang giingin ni Mom. Ito. Negative 17 to negative 22. Most hindi ni Sir Rex. So yeah, if it goes over that or it's under, then you can't use it because it might destroy the integrity of the specimen. So you can't read it properly. You can't know if the patient has something wrong or like. And you have to have like here in the staining area.
I'm just following him everywhere he goes himself.
So remember, this is the one for the pap smear, and this is one for the hematoxylin and eosin stain. So this is the normally used stain. So you have to follow this one, hematoxylin and eosin. So you have to follow that certain. You have to follow the process. It's a process. You have to follow it step by step, like how many minutes, how many dips, for it to be properly stained. So it's like 3 dips of Cylol and then leave it for 2
Can you
minutes,
share
and then 3 dips of the other Cylol. You have to follow that so that the tissue will be stained properly.
Okay.
You'll learn more about this in 3rd year.
Masud man it on slides.
Oh.
So this is where you put the slides. You have lots of slides.
What do you name? What's the
This
name?
one can
Slide carry.
slide carrier.
Oh,
This
okay.
one can carry about 10 slides. 10? 30 slides. 30
So
slides.
you dip it like
You dip it there.
and I'm not sure.
next.
Really sure I'm not.
Where you dip there?
Yeah, you dip.
It says. It says.
It says there.
Why are they different
3
colors?
dips and 2 minutes and stuff.
For a
There's different colors because it's like counter stains and like guns,
Yeah, kato siya tawag ato kay couplin jar. Kato kay sa slides dito like manual.
like manual because it's pap smear, diba?
Aray, ano ba yun?
The ones in the with the cylindrical one, that's for pap smear.
Pap smear.
Oh, pap smear. Bako bitaw. How formal.
Kasi una mo sabihin mo.
Kaya mag
That box over there, that one, that's the left leg.
What box? This one?
open.
There.
This one? That's nice. Okay, that's nice.
And there you can see like there's an ovary, there's a uterus over there. You see the needle.
Dude, what is this?
This is the blood bag. This is where like the blood of the blood donors gets in. So yeah, the needle for the blood donor and this blood bag is about the size of a fun chunk straw.
Sir, from here it goes there.
Yeah, like while it's screening, right? You're screening the patient. So while you're screening them, you get blood from them, and then their blood will be tested there if it's positive for HIV or anything to know if it's safe. Because if we don't test it, then we don't know maybe the patient has maybe the donor has HIV and then it'll be passed on to
to the patient. So look kayo, diba? The patient just wanted to live. And then now, he or she will die because of the blood. So yeah, so this is the blood bag. It can, this is for, yeah. And
Sorry.
when you're 17, when you're still 17 years old, so you need the parents' consent. So you
I'm
parents have the right, like, I allow my child to donate
Dude,
blood.
I can
When you're
donate my
18
blood.
to 65, then it's fine. You can just donate whenever you want.
What if you're 66?
I don't know. Oh, yeah, it has to be within that. It has to be within that age limit because for it to be safe to you. Because when you're too young, means you have a small body mass. As long as you're fit. Yeah. Yeah. If you're also. Wow. How many? 400? Bata per day. And then your weight has to be at least 50 kilograms or 110 pounds.
Can we take a picture of that?
Oh, sure. Here.
Tikaro, Tikaro. Diman siguro.
So your weight has to be at least 50 kilograms and 110 pounds.
Guys, go ahead.
Why this weight? Because Louis and Becca, you're the donor, right? And you have to be this, because if you have small body mass, it means you have only small amount of blood. So if they take 450 ml, it'll make it stall on you, like malikong ka and stuff like that. It's not safe for you. That's why you have to be this weight so that it'll be at least safe for you to donate blood, because it's a lot. It's 450 ml, and yeah, it's like taking something from you. So yeah, like it's part of your blood, and then they're taking it. So yeah, at least you have to be safe. And then the temperature of the patient must at least be less than 37.5 degrees Celsius, so that, to assure that the patient isn't sick. Because if the patient has that high temperature, it means like he has a fever or something. And we have to avoid as much as possible any kind of infection, because we don't know if it might be given to the patient or not. And then the pulse rate has to be 60 to 100 beats per minute. 60 to 100 beats per minute. And then the blood pressure has to be 90 to 140 milliliters or mercury as mmHg. Like this. Sorry, tell me if I'm talking too fast. 90 to 140 mmHg for the systolic
You took a
pressure.
picture of it, right?
And for the diastolic, it's 60 to 90 mmHg. And then for the hemoglobin, for the males, it has to be 13.5 to 16.5 grams per deciliter. And for females, it has to be more than 12.5 grams per deciliter or 16.5 grams per deciliter. And then hematocrit has to be, for males, 40 to 50 volumes percent. And for females, it has to be 37 to 47 volumes percent. Get it? Yeah. So there's a lot of criteria for a person to be a blood donor, just so that it will be safe for the patient or the nurse.
Okay.
We also have this. Oh, sure. And we also have this questionnaire. So you have to ask the patient a lot of stuff about his or her medical history, like how many, like what's important is also how many sexual partners has that person had. Because, if a person has had a lot of sexual partners, then it's more likely that that person has contracted an STD. And if you don't know, and you just directly give his blood to a patient, then what if what if the donor had an STD? So yeah, you have to ask them a lot of stuff. Like for example, if I traveled to Palawan just last week, then I can't donate today because it has to be at least a year after, because malaria is endemic in Palawan, and then malaria, and the causative agent of malaria is a blood parasite, so it can easily be like transmitted to the different to the patients. So that's why it's like you have malaria. If you went to Palawan, it has to be at least 1 year. If you went to Africa, it has to be at least 1 year. If you have tattoos, it has to be at least a year before you can donate. Or piercings, it has to be a year before you donate. Actually, just last week, I wanted to donate blood because there was this baby who needed O positive blood, and then I wanted to donate, but I couldn't because I had a little eye infection. It's still healing, and no matter how small the infection, you can't donate. So yeah, that's it. And if you have like hepatitis B or if you have HIV, then you can't donate for the rest of your life because it's like we call it deferral, so it's a permanent deferral. So it's okay that you have a tattoo. If you have a tattoo, it has to be at least a year after you had that tattoo.
Okay.
So yeah, it's okay. It's safe. Because sa una we thought that you can't donate if you have tattoos, but now it's like proven that you can donate as long as it's a year after you got that tattoo. Because you don't know how dirty that like that tattoo thing is. The needle thing, diba needle, so that it goes to your skin and to your capillaries, your blood. So your blood isn't that isn't that clean. So if you donate, it might not be safe for the patient. And yeah, so that's why we encourage voluntary blood donation is because when you donate blood, diba 450 now, so makuha ka blood, then your bone marrow produces new blood cells. So it's healthy for you because normally your body will just recycle the blood cells, like recycle the cells if they're not broken, just recycle them. But if you donate blood, you get a lot of blood like taken away from you. Then your bone marrow produces more, so it's healthy for you. And at the same time, while it's healthy for you, you're saving a life. So it's a win-win situation. So it takes about 30 minutes to an hour for this blood bag to be filled. So that's where the patients lie down while their blood is being taken. Yeah. So
Why is it shaped like that?
So it'll be comfortable for the patient. Because if it's just a straight bed, some patients like have sensitive backs, and then that's where like my elevating head, my elevating feet. Because when you donate blood, you get like dizzy because it's a lot of blood taken away. So yeah, that's why. You guys have any questions? Okay, so let's proceed to the other department.
Having your blood taken
See, it's
for,
on the same.
like, you're gonna donate blood and stuff, they're going to screen your blood. So to screen your blood, they have multiple number of tests. So like for HIV testing, it's done in this lab.
It's double as dead.
All those STDs and stuff. This machine is used for
It's actually speaking
HIV
Chinese.
testing. It's for screening, but not confirmatory. If it's for confirmatory, they send it to Manila because they're the only lab with confirmatory machine.
Okay.
Yeah. So if your blood reacts with this one, it means that you're type A. And then since it's yellow bird, so yellow means bird blood reacts with this one, it means you're type B. And then if your blood reacts with both of these, you're type AB. And if it doesn't react with both of these, then you're type B.
That's me.
And the white one is for the anti-B. This is for our system. So if it reacts with this one, then you're RH positive. So for example, your blood reacts with AB, and then your RH positive, so you're maybe positive. And then if it's like, if it doesn't react, then you're RH negative, so you're AB negative or negative. So there are two types of blood typing, which is the forward typing and reverse typing.
Forward typing and reverse typing.
The reagents I just showed you a while ago, these three, these are used in forward typing. Because the specimen is your blood or your red cells, and then the reagents are the antiserum. And then for reverse typing, it's like backwards. The specimen is your serum, and then the reagents are your red cells. Yeah. So like it's also called reverse typing because it's like balikan siya. If your blood reacts with the A cells, it means you're type B. If your serum reacts with your B cells, it means you're type A. And then if it reacts with both, it means you're type O. If it doesn't react with both, it means you're type B. So yeah, it's reverse. These are your reagents. So all you have to do is take note of blue angel, yellow bird. So if it's blue, it's for anti-AIDS. If it's yellow, it's anti-AIDS. If it's white, it's RH or anti-B. So yeah, that's so